Do you sometimes suffer with burning in the middle of your chest? Maybe you have a hoarse voice, a funny taste in your mouth. Maybe you have a cough that's worse at night. You might sometimes feel sick and bloated. Well, it could be that you are like 1 in 4 adults who are suffering with acid reflux, also known as heartburn. So keep watching because I'm going to give you all my best tips and tricks to help manage this. Before we start, I'm going to draw you a quick picture because I think it's important you know what's going on. This is your esophagus, which is essentially your food pipe. Fancy name, we always like to make it complicated. And this is your stomach. And your stomach is obviously full of stomach acid that's really important to help break down your food and absorb important nutrients. And you have a ring of muscle here that acts like a door and it shuts that acid from being able to come back up to the esophagus. So it's very important. And then once you've got reflux, so I'll draw the same picture again, and you've got all the stomach acid. But then what happens with that ring of muscle is it stops doing its job properly and it weakens and it becomes like an open door. So all this acid can then travel up the esophagus, the food pipe, causing all those burning symptoms and other things which we've just mentioned. And then if you think about it, anything that's going to increase the pressure on the stomach is going to make even more of that acid come up. So things like being overweight, carrying too much weight around your middle, lying down soon after eating, being pregnant, not much you can do about that one. All those things are going to increase the pressure in the stomach, making more of that acid come up into your food pipe. So what can we do about it? Well, think about anything you can do to help relieve that pressure on the stomach. So eating late at night is not going to be helpful. So ideally, you'd want to wait about 3 to 4 hours before you go to bed from your final meal. I know it sounds quite a long time, but that will also help you sleep better. You want to avoid certain trigger foods. So kind of spicy meals, greasy meals, acidic fruit, caffeine, and also smoking is going to make things worse. So if you can avoid those things, that will help improve your symptoms. Trying to maintain a healthy weight. So try not to be carrying too much weight around your middle. That's going to also help. Alcohol is going to make it worse as well, which will also help you maintain a healthy weight if you cut down your alcohol. So that's a win-win. And a little trick is also to raise the head of your bed by about 10 to 20 centimeters by, for example, adding some books underneath one side of your bed. And this can just help relieve the pressure in your stomach when you're asleep. Avoid doing this with just adding more pillows because actually that can do the opposite and actually increase the pressure. So it's all about lifting the bed up rather than the pillows, and that can make a difference. So if you're doing all those things and you're still not getting anywhere, some people like to just try some home remedies before they go and see their doctor. So we'll go through what those could be. Some people like to try baking soda, which is actually the active ingredient found in things you can buy over the counter, such as like Alka-Seltzer. And this can help reduce the stomach acid. However, for some people, it can actually make the symptoms worse. It can be quite dangerous. So certainly shouldn't be used regularly. You should only have a small amount. Make sure it is absorbed well into some water and sip it slowly. Now, licorice is another one. It's like an old remedy that people used to use. And there is some evidence this can help, but it can also interact with some of your medications if you have too much of it and even affect things, your electrolytes, like your potassium. So again, don't go too crazy, but you can try some if you would like. Chewing gum is one that's often suggested. This can help produce more saliva that can reduce that amount of acid coming up into your stomach. Just make sure it's not a peppermint flavour because that can actually make your acid worse. And then the other thing is apple cider vinegar. Now, this does sound strange because apple cider vinegar is acidic, so you'd think that would make more acid in your stomach. And I think this is based on the belief that sometimes the symptoms are caused by having not enough acid in your stomach. I couldn't find any good evidence for this, and in fact, apple cider vinegar could make your symptoms worse, so it's not one I would recommend. Another option is to go to the pharmacy. There's lots of stuff you can buy over the counter, even at supermarkets, for things to help with your reflux. Try them, see which works best for you. The thing to be aware of is that these are not meant to be used very regularly. So if you're finding that you're using them all the time or you're getting symptoms despite using them, then this is when you need to make a trip to your doctor's surgery to see what we can do to help. The first thing we're going to check is what we call red flags to make sure there's nothing more sinister going on that's going to make us worry. So that's things like losing weight unintentionally, so you didn't mean to, but you're losing weight. You've got frequent vomiting, or you've got food getting stuck. So they're things we want to worry about and do some further investigations. If we're happy it's not that, then we might suggest to you to try medication called a PPI, which is a proton pump inhibitor. And these help lower the amount of acid in your stomach. You might know them by the brands as lansoprazole, omeprazole, Losec, Nexium. And now these do work, but The key thing is you shouldn't be on these for very long either. So often people get put on them and just kind of keep on taking them and go, yeah, I did feel better, that helped. But actually you should only be on them for about 4 to 8 weeks, as long as there's nothing else going on. So these PPIs aren't without side effects. And in fact, we're becoming more and more aware of this. And certainly in the UK, we're looking at reducing people off these medications if we can. So the side effects include things like it lowers your magnesium level because you're not absorbing as many nutrients without that stomach acid. So when you've got low magnesium, you can feel dizzy, you can have heart palpitations. Long-term use of these PPIs can also increase your risk of bone fractures, gut infections, and vitamin B12 deficiency. It's also thought that it can possibly increase your risk of stomach cancer. So we definitely don't want to be on these PPIs long-term if we can avoid it. Now, for some people, they will need to be on a long-term PPI. But if that's not you, then try and get yourself off if you can. Now, be prepared, because what happens if you suddenly stop the PPI, your symptoms will get worse. You get rebound symptoms. So it's always best to try and wean off slowly. We're also probably going to ask you about medications you're taking, because some medications can make reflux worse. That includes things like some antibiotics, some antidepressants, some blood pressure medications, and anti-inflammatories, so things like ibuprofen. So for example, if you're taking a lot of ibuprofen, try and cut that down or stop if you can. That can help. And we'll look and see if we can manage your medications to help reduce your symptoms. If we're not getting on top of your symptoms despite doing all of this, then we may well test for a bacteria in your stomach called H. pylori that could be making these symptoms worse. Or order a camera test down the throat, into the stomach, to have a look and see what's going on. Some people have such severe symptoms that they do require surgery, but that is rare compared to the volume of people who manage with it okay. So that was acid reflux. Check out my other videos for more honest, reliable, trusted medical information. Like and subscribe, and do comment below. Thanks for watching.